This is CCTA case number 25. The history is that of a 67-year-old man with diabetes who has an abnormal resting electrocardiogram. There are two phases for review which can be changed by going forward or backward on the CCTA controls. A couple interesting features in this individual. Let's first start by looking at the coronaries. There is the left main coronary artery. Appears to be very normal. As we proceed down looking at the remainder of the left anterior descending, this vessel likewise appears to be quite normal. Let's get back to the main area and look at the left main. We should be seeing the left circumflex coming off roughly at a portion near the left main. As we proceed down, very difficult. Matter of fact, I don't see any circumflex. And then as we proceed downward, we begin to see a vessel popping up that clearly follows the left circumflex distribution. But in fact, its origin, if you look a bit more carefully, actually comes directly from the right coronary cusp. So we have this type of view here where we can see an aberrant left circumflex vessel coming off the right coronary cusp, passing posterior to the aorta and of course posterior to the pulmonary artery, and then assuming its normal anatomic course, otherwise unremarkable. So this is a benign congenital coronary anomaly. If we look at the remainder of the right coronary artery, we can proceed by wrapping around to try to get the rest of this vessel, and it's actually quite normal. Change the phase a little bit, you get a little better view of the distal portion of the right coronary artery, but this is indeed normal. One other feature of this patient, which is also relatively common, is as we look about the area of the aorta, somewhat posterior to the aorta, we can see a relatively dark area over in this region. Perhaps a change in density will allow you to look at this a little bit better. This is an area that appears to be of a sort of a fat density. The best way to do it is actually check the CT number by looking at it in this area. We're getting a value of about -80. As we move about, this falls into the typical range of a lipomatous structure, which is generally -30 to -150 Hounsfield units. Now, this is an intra-pericardial lipoma, benign, relatively uncommon finding, but certainly something you'll see probably out of 1 out of 200 cases. Let's take a look at, I've done some sculpting of the coronary arteries just to give you a better view of that. Here's the left anterior descending coming off normally, and then here is the right coronary artery, and you can see the aberrant circumflex passing posterior to the aorta, clearly not involving any portion of the pulmonary artery, and again a benign anatomic finding. So this 63-year-old man with diabetes actually has a very low cardiovascular risk situation. He has a congenital coronary anomaly which is anatomically benign.